name is Brittany.
My name is Edgar.
I'm Jessica.
And I'm Peggy.
And we are student nurses at Nevada State College. We will be presenting to you a current priority population in the community, that known as the homeless persons. Our objectives for this presentation include discussing the homeless in the community, who they are, how they may become homeless and why, the health effects of being homeless, statistics showing incidence and prevalence of this population, a case study that goes through a common experience that the homeless may go through, the nursing role, interventions, access and barriers to care, and resources for this population, and then we will conclude with a summary. So what does being homeless mean? Well, being homeless usually starts off with being in poverty. So these are the poor people. These people have little to no money, goods, or means of support. And after any kind of events, this can lead to homelessness. And the homeless are seen as being the poorest of the poor. So people that are more fortunate look at these people as being faceless, nameless, invisible, and inaudible. And they also see these people as being beggars or troublemakers or people that just weren't able to deal with life's forces. So the Stuart B. McKinney Homeless Assistance Act of 1987 defines homelessness as lacking a fixed, regular, adequate nighttime residence and having a primary residence that consists of either a shelter, an institution such as a mental facility, a temporary accommodation such as sleeping on a friend's couch, or a public or private place that ordinarily isn't meant for human beings to sleep on, such as the streets. And homelessness is also defined as being those who face eviction within 1 week. So there are two concepts of describing homelessness. There are those who live in crisis poverty and those who live in persistent poverty. So those who are in crisis poverty are those whose lives are marked by hardship and struggle. So these people are usually transient and episodic homeless. So they have brief stays in shelters or temporary accommodations. And this is usually the result of lack of employment, lack of job opportunities, lack of job skills, education, divorce, or domestic violence. And in order for them to not progress into persistent poverty, they need to find stable housing. So people in persistent poverty are those who are chronically homeless. So these are what society sees as the homeless people. So they may have physical or mental disabilities, which also coincide with substance abuse, alcohol abuse, chronic health problems, or family difficulties. These people lack money and means of support. So in order for them to survive, they have to have ongoing economic assistance, rehabilitation, and support. Homelessness does not discriminate. So anybody of any age, any race, sex, any kind of family type, anybody, no matter where you live in rural areas or suburban areas, it can affect anybody. And once this happens to a family or an individual, they usually resort to finding a shelter to sleep in at night, and then they're on the streets during the day. So most of the homeless are found in public buildings such as train stations, bus stations, abandoned buildings, 24-hour movie theaters, or even living out of their cars. And when they're in the streets during the day, they are usually under freeway underpasses, alleyways, parks, and they use trees or cardboard boxes or anything they can find to try and shelter themselves from the weather. So the details, who are these people? What kinds of people become homeless? Well, most of them are single, young, and educated, which goes against the stereotype that most homeless people are seen to be older, uneducated, or maybe war veterans, which that may be true. They're actually longstanding residents of wherever they reside, and they have a history of job success as well. So this goes to show that homelessness can affect anybody at any time or in any circumstance of their lives. Most homeless people are seen to be men over women, and this might be because there are an increased number of women's and children's shelters in the community. There's also seen to be an increase in homeless families over the past decade, and a longer stay in the shelters as well. So more families are becoming homeless, and they're resorting to living in these facilities for a longer period of time. There's also an increased number of domestic violence victims and armed force veterans that are becoming homeless as well. So if you look, this chart shows the difference in ethnicities of homeless in the shelters. So as you can see, that there's an abundance of African Americans and Caucasians that utilize these shelters, and it may not be accounted for the abundance of the different ethnicities that are actually homeless. So why are these people becoming homeless? Well, with the economic shift, there's been less affordable rental housing, an increase in poverty, and an increase in home foreclosures. A lot more of the neighborhoods are becoming gentrified, meaning they're being upgraded so that they can weed out the poorer people out of the neighborhoods, so that the neighborhoods become more cleaner and safer, and just to increase the amount of wealth in the neighborhoods. The work wages are becoming more insufficient to pay for the housing inflations, and because poverty relates to homelessness, people aren't able to pay their mortgages as well as daycare and everyday expenses, and then on top of that, some unforeseen events, which leads them into homelessness. So the shelters and the different facilities are actually a last resort for them for safety and shelter. So how does homelessness affect the community's health and the community as a whole?
The most common causes of morbidity and mortality in the homeless population is often associated with poor health outcomes, often due to harmful living conditions and limited resources to buy food and obtain shelter. The prevalence of illness in the homeless population can be as high as 55%. The average life expectancy of a homeless person is up to 44 years old compared to somebody that is not homeless who can live up to 78 years old. There's a greater incidence in acute and chronic illness, HIV and AIDS, and trauma in the homeless population. They have a higher risk of physiological problems and a greater difficulty in accessing healthcare services, although homeless people frequently access urgent care services to obtain food and get out of extreme temperatures in their environments. And they often don't follow the treatment regimens that are prescribed to them from their doctors. Common health problems in the homeless population include infection and psychosocial issues. Infection includes HIV and AIDS, the increased use of IV drug use, and increased risk of sexual activities can make the homeless people prone to HIV and AIDS. They also are affected by respiratory tract infections, including tuberculosis, multi-drug resistant tuberculosis, pneumonia, and COPD. This is often due to the illicit drug use, the alcohol abuse, and the crowded living conditions that the homeless people reside in their shelters. They can be affected by foot infections, so they might not have shoes. They might have inadequate shoes to protect their feet while they're walking around in the street. Psychosocial issues include depression, so homeless people weren't always homeless. They've lost family and friends, and they lost their personal belongings. They're stressed because they're living in unstable environments, unable to know whether they'll have something to eat that day or whether they'll have a bed to sleep in at night. Individuals with severe mental illness make up to 26% of the homeless population that utilizes shelters. Substance abuse can be found in the homeless population, and And this decreases their sensitivity to temperatures, so they can be affected by hypothermia and hyperthermia, and they're not able to know whether they're affected by it or not. Other common health problems include trauma. Trauma is a common cause of mortality and disability in the homeless population. Major traumas such as gunshot wounds, stab wounds, suicide attempts, and fractures, to minor traumas like bruises, concussions, and cellulitis. They can be affected by hypothermia, so they might not have adequate clothing to keep warm in the winter. Heat stroke and dehydration in the summer. It gets really hot here in the summer, so they're sweating a lot. They might not have clean drinking water to replace the fluids that they lost. Infestations, they might be affected by bed bugs and lice that are in the beds in the shelters that they use. Cardiovascular diseases like peripheral vascular disease and hypertension. Peripheral vascular disease, if a doctor tells the patient to sleep with their legs elevated or sleep with the legs hanging off their bed, they're not going to be able to follow these instructions because they might not have beds to sleep on. They might be sleeping on the floor, on the streets, so they can't follow these instructions. For preterm birth and low birth weight, a homeless woman, if she's pregnant, she's unable to access food and prenatal care to maintain the health of her and the baby, so her baby can be born preterm or with low birth weight. Sexual health issues, the homeless population has limited access to condom use, and they lack sexual knowledge. Musculoskeletal problems, they might suffer from chronic pain or arthritis, which is exacerbated by sleeping on hard cement, sleeping on gravel. Malnutrition, they're unable to provide food. They can't afford food, and even when they do have money to access food, they're going to choose to go to cheap fast food restaurants, and these fast food restaurants typically have a menu with high sodium content and high cholesterol content, so it's very unhealthy. Diabetes, they might not be able to access any insulin, and they're not going to be able to access food to maintain their blood sugars, or they're not going to have a machine to check their own blood sugars. And the main priority of the homeless population is to survive by obtaining food and shelter. Health maintenance and health promotion is not a priority for this population. And these are the 2010 census rates. As you can see, it shows a total population for the US and then a total population for Nevada. And in the bottom, it shows the utilization of emergency and transitional shelters by the homeless population. So there are 209,325 people that are homeless in the United States. That's only 2.6% of the total population in the US. There is 1,338 people that are homeless in Nevada. That is only 0.04% of the total population in Nevada. These rates aren't very accurate. Homeless people are difficult to track down. Some are living in abandoned cars, abandoned buildings, under freeway exits, and these numbers are only for the people that utilize homeless shelters. These are the factors contributing to the vulnerability of the population. There's public bias. In the American culture, we expect to go to college, to get a job, and to start a family. Although we don't think about the weak job market. We don't think about shutting down and downsizing of companies that affect individuals losing their jobs, losing their income, and they're unable to provide food and shelter for themselves and maybe their families. We want to acknowledge personal beliefs, responsibilities, and autonomy that's ingrained in the American culture, and we want to limit assumptions and listen to the homeless person's story. We want to provide outreach to the homeless population. In the American culture, sometimes we think about problems being our own, but if we provide outreach to the community and we provide help to them when they need it, we want to make sure that we're aware of the patterns of the homeless population. Sometimes they're not chronic homeless, they're transient homeless, where they're only homeless for a temporary amount of time. There is limited access to space and beds and shelters. Some shelters are first come first serve, so if they don't show up there early, they're not going to get a bed. Some have guaranteed beds where they guarantee beds for a certain amount of time, and some are temporary shelters in schools and in churches during severe weather conditions. And we want to make sure we're aware of the attitudes of healthcare providers and the coordination of services that are provided. Sometimes a homeless person can show up to the ER and they're claiming they have chest pain. They're claiming that they want to attempt suicide. And if you know this person is homeless, you want to coordinate with the social worker because they're just trying to get off the street. They're trying to find a place to sleep, find something to eat. And we want to also coordinate with the case manager to provide transportation to the homeless population when they don't have a ride to and from their clinic site.
So, if you're poor, you're essentially an illness, an accident, or a paycheck away from living on the streets. This is what happened to Frank. Frank is a 35-year-old African-American male who's been working minimum wage for most of his life. Frank lost his job and was unable to pay for his housing costs. He eventually was evicted and had to resort to living on the streets because he had no family or social support. Occasionally, he would get a bed at the homeless shelter if there were any available. Frank sleeps in uncomfortable, cramped conditions at night and is on his feet for most of the day trying to find his next meal. The food he eats is either from fast food or meals from the homeless shelter. Frank has been struggling with coping with what happened to him and has resorted to drinking. In addition to his drinking problem, he has very low self-esteem and bouts of depression. Frank used to go to his primary care doctor if he was sick, but after he lost his job, he also lost his insurance and he no longer can pay for the care that he needs. So instead, he goes to the emergency department if he does get sick and needs some help. Nurses caring for the homeless need to be aware of the different problems that this population faces. There are two trends that contributed to the rise in homelessness over the last 25 years: an increase in poverty and a decrease in affordable housing. There's also a decrease in available jobs and a decrease in adequate wages to support the housing costs. In 2009, the average worker needed to make $14.97 an hour in order to afford a one-bedroom apartment. There's also a decrease in the availability of public assistance, lack of access to care, mental illness, and substance abuse. There was a deinstitutionalization of the mentally ill from large psychiatric hospitals. The goal was to move the care from these large facilities to community treatment centers. Unfortunately, after the hospitals were downsized, the funds weren't provided, and it left many of those without care and living on the streets. So for Frank, he lives in poverty. He lived in poverty before and after he became homeless. He can't find work because of the decrease in available jobs. He rarely gets a bed at the homeless shelter, and he doesn't have insurance, so he faces many problems with getting care. The homeless population also has potential health issues that are seen. There are challenges related to self-care, which include things like teeth, skin, and feet, because of a decrease in regular access to things like dental care, nutritious foods, and regular places to bathe. There are also challenges related to following a prescribed regimen. For example, a diabetic man who's living on the streets, it's virtually impossible for him to follow the prescribed regimen. There's also trauma related from hypothermia, dehydration, and heat stroke. You'll see peripheral vascular disease, respiratory tract infections, tuberculosis, hypertension, AIDS, and mental illness. For Frank, he sleeps in cramped conditions, so he's at risk for poor circulation. He also is at risk for hypertension related to his high alcohol intake and diet high in sodium. The crowded living conditions put him at risk for pneumonia and tuberculosis, and his increase in alcohol put him at risk for a diminished immune system. Nurses caring for the homeless need to be aware of the probable coping strategies that are seen. There are two types, maladaptive and adaptive. The maladaptive coping strategies include things like withdrawal, depression, anxiety, aggression, regression, risk-taking behaviors, and substance abuse. For adaptive coping strategies, things that are seen are you'll see them using social services and seeking treatment. You'll see them trying to improve their work or educational skills and also spiritual strategies. For Frank, he has become anxious and depressed since he started living on the streets. He also increased his alcohol intake, and he's unaware of the social services and treatments that could help him. Frank is one of many that face these kind of issues. Proper nursing care and interventions are needed in order to improve the health of the homeless population.
So nurses are directed to protect and promote the health of those in their care. As nurses, we need to provide a wide array of interventions to help provide care for the homeless population. First and foremost, we would need to address Maslow's hierarchies of needs. This starts with the basic needs of food, clothing, and shelter. If these basic needs aren't addressed and taken care of, anything else is irrelevant. Psychological and social needs such as crisis intervention, mental health, substance abuse, self-esteem, lifestyle, family and social support systems, interpersonal skills, and skills advocating for oneself in a challenging environment need to be addressed, and we need to provide interventions to help the homeless person maintain their quality of life. We also take on the role of providing referrals for financial support like welfare and with housing assistance and shelter placement. Thanks to programs like SafeLink, or better known as Obama phones, many homeless people now have access to cell phones. With this new benefit, clinics that provide care to the homeless population are able to send text messages that provide reminders of appointments. It is a feasible, effective, and acceptable means of communication, which increases the engagement of improvement of health care, decreases the utilization of expensive ED and hospital care, and has resulted in fewer canceled and missed appointments. A last intervention we may implement is discussing goals, desirable outcomes, and spiritual practices that would help them to gain better control when they're facing these overwhelming physical, social, and environmental happenings. Specific potential nursing roles and interventions would include working or volunteering in immunization clinics that would provide free immunizations to the homeless person. We would also provide care and education for health concerns such as hypertension and diabetes. We may also run, work, or volunteer in clinics or health fairs intended for homeless persons to receive free health screening and provide a limited amount of care such as medication and diet education. With the limited access to care, we must provide education on health promotion at every opportunity. Educating our homeless patients on coping techniques will help improve their quality of life as well. We take on the role of counselor and educators and help our patients deal with stress and other psychological issues that are more seen in the homeless population, such as sense of shame, poor self-esteem, and low motivation. Also, as nurses, we need to educate our homeless patients on high-risk behaviors such as alcohol consumption and drug use. We would need to explain the potential for causing harm to oneself and increase in their vulnerability and risk for trauma. It is also imperative that we help our homeless patients provide self-care and maintaining personal hygiene. Not only will we treat their wounds in an acute care setting, but also educate them on the needs to maintain their wounds clean and return for follow-up care if needed. As mentioned previously, there is a high prevalence of HIV and AIDS in the homeless population. And again, we need to address the risky behavior that the homeless population is more likely to engage in, such as risky sexual practice, injection drugs, and sharing needles, and trading sexual acts for money, drugs, or a place to stay, which again, our role as educators and advocates come into play. We would need to educate them on the risk of these behaviors and advocate for the need of routine testing and accessible HIV and AIDS treatment. So access and barriers are important factors when it comes to providing care for the homeless population. One of the greatest determinants for access to care is whether they have health insurance, which in turn provides positive health outcomes. A lack of health insurance is a significant factor in the homelessness inability to obtain medical care, prescription medication, and mental health care. While there are many resources for the homeless, they may not be fully utilized by the homeless population because they're unaware of these resources. Therefore, as nurses, we would need to emphasize on educating them on the other options and different resources available for them. Other barriers include social isolation and prioritizing survival needs over health needs. Another barrier includes the lack of education in children, related to the lack of school supplies, clothing, poor health, fatigue, hunger, and transportation. As children, all children need their education so that they can express their needs. Fortunately, the Stuart B. McKinney Homeless Assistance Act grants homeless children the same access to education as permanently housed children. Support can also be found through the Interagency Council for Homeless and through the WIC program, which provides activities, shelters, and nutritional assistance for those who need it. The only problem with these resources is that they are grant funded, and if not used, the funds will be diminished or transferred to other programs. Local resources include the Nevada Homeless Alliance, formerly known as the Homeless Coalition. The Nevada Homeless Alliance has assisted more than 1,500 homeless clients. They promote homeless awareness within our community and also provide referrals to free clinics, shelters, and to food banks, and to the welfare department as well. Catholic Charities of Southern Nevada provides housing, food service, senior support, and services for children and family. Las Vegas Rescue Mission provides shelter, meals, and addiction recovery program, and as well as employment through their thrift store. The Salvation Army is one of the longest standing organizations that has provided support to the homeless population. They provide shelter, employment, referrals, and a food pantry as well. Safeness is one of the shelters that's for women and children only. They are solely devoted to clients that are domestic violence victims. They provide shelter, advocacy, counseling, and prevention for their clients. Shade Tree is another women's shelter. They believe that no one should ever have to endure a state of homelessness or existing in fear for personal safety and without the means to meet even the most basic essentials like shelter and food. They are another shelter for women and children. Next is Living Grace, which provides housing for pregnant teens who no longer have support from their family. They also provide support 2 years after the teen has given birth to their child. They provide education as well as employment training. We also have Street Teens, which supports homeless teens and at-risk teens. STREET is an acronym for Survival, Trust, Resources, Education, Empowerment, and the homeless teens. They provide immediate support to help the teen survive. They build relationships based on trust, on mutual respect and trust. They provide the resources that are needed at the time that the teen is there. They provide education and opportunities to rebuild their self-esteem. They also empower the teens to move forward and become an effective member of our community. Then we have Nevada Partnership for Homeless Youth. They are an outreach program that provides shelter and placement back with the family and independent living programs as well. They are a comprehensive provider for thousands of youth within Nevada. Last but not least, we have Nevada Home for the Youth. They provide a comprehensive program as well that gives Nevada's youth the tools and solutions they need in order to overcome addiction and homeless within Nevada.
So in conclusion, we have discussed who the homeless and homeless population are in the community, the contributing factors to how they may have become homeless and how it's affected them mentally and physically, how being homeless has affected their health and future health outcomes related to access and barriers to care, and how we as nurses can care for these individuals as we are in our careers and come across them, whether it's at the hospital, in the community, or even at the grocery store. So in order to care for these individuals and implement the nursing care and interventions, we always need to be aware of our own feelings, beliefs, and values about the homeless. And we always need to be aware of any possible influences that may come their way to bring positivity to their situations. Thank you.